A health professional who is on the front lines of COVID-19 fears that people are not taking the virus seriously. Ballad Health Chief Medical Officer for the Greenville Market, Dr. Daniel Lewis, believes many are doubting the effects and the impact of the virus. Febin Casahoon spoke with Dr. Lewis via Zoom to find out the message he's trying to get across.
Dr. Daniel Lewis says that it's encouraging to see that the death rate is much lower than the survival rate here in the Tri-Cities, but he says it's important to remain vigilant about the virus. Recovering COVID-19 patient Dr. Daniel Lewis is urging people to protect themselves.
But based on the number of cases that we're seeing and the conversion rates that we're seeing and hospitalizations, it is here present in the community now.
He wants stricter guidelines for mask wear.
You wear a mask not only for yourself for protection, but more so to protect those around you and to keep you from spreading it when you may be asymptomatic or may have an exposure to the virus that you're not aware of.
Since anyone can get sick from it, no matter age or health, Dr. Lewis is urging everyone to social distance and to stay at home.
For things to return to normal in the fall with sporting events or school or what have you, people need to take steps now to mitigate the spread of the virus at this point.
From contracting COVID-19 to recovery, the virus has taken about 3 months of his life.
I developed blood clots secondary to COVID-19 that I'm still under treatment for and will be under treatment for at least 6 months. I've had repeat testing done that'll need to be repeated annually for an unknown period of time.
He fears many aren't treating COVID-19 like a real threat because it hasn't crippled the Tri-Cities as it has other areas.
Still haven't returned to work completely full-time as of yet.
Dr. Lewis says while you may not die from the virus, it can still have significant effects.
I spent 10 days on the ventilator in Johnson City intensive care, developed significant complications, including blood clots that developed thereafter. So it was a grave situation for me for a period of time.
He says if we do follow these guidelines, we can expect to see ourselves return to a normal state in the next couple of months. Reporting in Johnson City, Febin Casahoon, News Channel 11.